People across Quebec could soon find themselves waiting longer to see their doctor or not have one at all. Hundreds of doctors have left the province or are planning to do so. That's after the province pushed through compensation reforms that physicians say creates higher expectations but provide few resources to help meet them. The CBC's Mark Carcassol is here with more. So, Mark, this is a really contentious issue in the province of Quebec. What can you tell us?
Yeah, the issue before doctors and politicians in Quebec is Bill 2. It was passed by the Quebec provincial government a couple weeks ago. It forces a new pay system on the province's doctors. Under that specific law, a portion of doctors' compensation will now be linked to various performance standards related to the number of patients they see, particularly vulnerable patients. But doctors argue that they have the same goals as the province when it comes to targets that are expected that they would meet, but doctors have repeatedly warned they can't meet those performance targets without more resources from the province. They just don't have the tools and resources available to them to do so. Now, what could be a detriment to Quebec's medical professionals, Quebec's health agencies, and Quebec's patients could end up being a benefit to neighboring provinces. For example, in an email to CBC News, the College of Physicians and Surgeons of Ontario reports that since October 23rd, that's a couple days before Bill 2 was passed in Quebec, 250 doctors have applied to come from Quebec to work in Ontario. In that email, they tell CBC News that more than half of applicants are family physicians. The remainder practice various specialties, general practice, pediatrics, radiology, anesthesiology, and others. And just last week, the College of Physicians and Surgeons in New Brunswick reported that they had received at least 50 applications from Quebec doctors to come over there. We're still waiting on updated figures from them. So you could see where the situation lies, and you could see why many patients, people like Camille Cossette-Girard, worry. She has been informed that her doctor, as a result of Bill 2, is resigning as of April. Now, she doesn't know if her family is going to be doctorless. She doesn't know if the entire clinic is going to be closing down, if someone is going to take their family on, but she worries nonetheless, and she worries that Bill 2 punishes doctors like hers, who she says is a good one.
I feel like right now the government is punishing the doctors, whether they're good or the bad. Maybe there are doctors who could take on more patients, but I don't think that it's fair to say, oh, you have a clinic, it works very well, everybody's happy, everybody can get what they need in less than 2 weeks, and even in a day if it's an emergency, and they're punishing for doing what they are doing well.
Now, the province of Quebec says Bill 2 is a way to push through an impasse in mediated negotiations with the province's doctors and medical professionals. They had offered 4 different offers to those professionals, but they still couldn't come to some sort of agreement. The various federations representing those doctors and medical professionals in Quebec says they will challenge this in court.
Mark, thank you. The CBC's Mark Carcassol. Our next guest is at the heart of this story. He is a Quebec doctor who will be resigning effective the end of December. Dr. Trevor Hennessy has been fighting to improve the system in the region of Outaouais for years. Currently, he is the chief of the Department of Anesthesiology at the Integrated Health and Social Services Centre of Outaouais. He joins us from Chelsea, Quebec. Dr. Hennessy, thanks for taking the time to talk to us.
Thank you very much for your interest.
First, just let us know, why are you resigning from your post?
I've been in the region 16 years. This is where I thought I would fit here as well. I've been in a leadership role for the last 9, almost 10, from 2016, and I've been fighting with my colleagues in surgery and anesthesia and our up from the 80% to the Quebec average. And now the nurse shortages are just at the point where it is unsustainable. Today and on Monday, we have 9 operating rooms out of 12 closed due to lack of nurses. 3 out of 12 are open, and anesthetists and surgeons are sitting at home unable to work. And yet this law says it is our fault.
That must be very frustrating, and I know that hundreds of doctors feel very similarly, are either resigning or thinking about moving to other provinces. You recently announced your resignation in a letter. This is what you wrote. You said, instead of addressing the core issues, the government has chosen to try to camouflage their failings and the failings of prior governments, and instead attempt to put the blame onto the shoulders of physicians by inferring that our inability to meet targets is by choice, and by penalizing us with a 15% reduction in earnings, we will be incentivized to actually work, all while privatization of care continues as the public system slowly dies the death of 1,000 cuts. So this is at the core of this, right? You feel as though you're going to be penalized, that you're being blamed for all of this because, I don't know, you're lazy? Is that kind of the implication, or something like that?
The implication seems to be greedy,
Greedy?
lazy. I'm not sure if you've ever met a surgeon who doesn't want to operate.
No.
Doctor who's sitting just drinking coffee and doesn't want to see his patients. But if every single stretcher is full in the emergency room and there's no triage nurse available and the laboratory and radiology technicians are insufficient to do the tests, and we don't have operating room nurses, and our ICU beds are completely full and there's no beds to admit patients into the hospital, what can we do? This law actually has nothing legally in it that says the government is a partner in this. Nothing in there says the government will provide the resources necessary for you to obtain these objectives. And so the government actually has, if you look at it, a perverted initiative to be able to reduce funding. If they reduce funding to areas, they save money, and then doctors cannot meet targets, and then they can save even more money then by penalizing the doctors. And then they can turn to the public and say, hey, we passed a law that doctors are failing you, it's their fault. It just does not make any sense.
So what do you think is going on? You've had these conversations with your colleagues, you've heard what the government has to say, so why in the world would they be imposing this law in a way you clearly think it doesn't make sense and it's not going to work?
I really don't understand. I mentioned before that Mr. Dubé and Mr. Legault are intelligent individuals. This cannot be a surprise. If it's not a surprise, is it a strategy? I don't know. They have been very vocal about their support for the private healthcare system. They've been very vocal about if elective cases take longer than 12 months, they will pay the private system to do these. We now have 182 private operating rooms at the start of October, according to their website, that are doing public surgeries paid by the public with public anesthetist, I'm there as well, public surgeon, they're there as well, but private nurses, private respiratory therapists, private secretaries, private préposés, where did those individuals come from? I'm without words.
You're without words, and now you're resigning. And I know that you're not the only one. We know that the College of Physicians for Ontario, near where you are right now, just across the bridge, right? There's 250 that have applied to practice in Ontario. What are you going to do? Are you thinking about that?
Well, I've already been forced to obtain my Ontario license in 2024 when, again, we had similar situations with operating rooms cut. And as I've recruited 5 members to my department from overseas, France, Belgium, Spain, and other areas, and they can legally not work anywhere else. And so I voluntarily left my family, and I've worked at the Montfort in Ottawa. I've traveled to Cowansville, 600 kilometers away to Roberval, to free up work for my colleagues here. So I have my license in Ontario, and so emails have been sent. I don't know where I will be as of Monday, and I know other people are looking at those same things. Talking about those nurses and respiratory therapists who have gone to the private sector, I don't blame them. With a system that treats them in a dishumane way with forced overtime and the conditions that they are in, I understand. But if we were appropriately resourced, I don't think we would be seeing people moving. And we're all in this for the public. We didn't do 13 years of education after grade 12 to just sit at home and do nothing.
And Dr. Hennessy, I think a lot of people are going to be sympathetic with what you're saying, but what is already a bad situation in Quebec and also in many parts of the country with doctor and nursing shortages, it could just get worse if people like you and hundreds of others leave the province for other provinces.
Well, positively and unfortunately for me, it won't make any difference in my region because we only have 3 operating rooms on Monday open out of 12. Yeah. So all this will do is allow my colleagues to actually be able to work instead of sit at home. Though in the future, if resources change and we finally can actually operate in our region, then my lack may be felt. But as of Monday, as of January, that's not the situation for myself. There may be issues in other regions, which is extremely unfortunate. These are not just patients. These are not just numbers. This is me. I live in this region. This is my wife. We live in this region. This is my extended family. These are my friends. These are my colleagues. These are my neighbors. This is my community. It's not just patients. It's us.
You sound angry, you sound frustrated. I mean, what is your message to the Quebec government about all of this? You mentioned, I just want to say, Monsieur Legault is François Legault, the Premier. Monsieur Dubé is Christian Dubé, the Health Minister. What is your message to them right now?
Listen, my name was uncomfortably released and publicly put in the National Assembly, and he said I didn't resign, despite I've informed him by emails and many media. Our region's forgotten. Please look at the regions, work with us, give us the resources that are necessary. If this needs to go to arbitration, let it go to arbitration, but let's work together so that the population is served.